Hello, everyone. My name is Dr. Brian Ho, and I'm a neurosurgeon. And I had the great privilege of being the chair of the writing group for the American Heart Association and American Stroke Association updated guidelines for treating patients with aneurysmal subarachnoid hemorrhage. This is an area where nurses play a huge role. We welcome Kiffon Keigher.
I am a doctorate prepared acute care nurse practitioner. I have about 20 years of neuroscience and stroke background experience, and I am really honored to have worked as part of this author group as a representative on nursing practice. And what's really essential to continue screening and evaluating our patients as we get them ready for that rehab stage and discharge to home. It is a class one recommendation that we should be screening for physical, cognitive, and behavioral health issues for that patient and really how those potential issues might impact their quality of life. There are a number of different scales we can use. We have our subarachnoid hemorrhage interventional trial list and our four scores, which help to identify and indicate mortality and 3-month functional outcome. We have our fresh scores, which help us to identify and indicate quality of life. And then we have our MOCA cognitive assessment tools, which really help us to identify any kind of cognitive deficits that they may have as they transition out of the hospital to try and get back home into a baseline.
We know that depression and anxiety is really common in patients that have just gone through such a traumatic event. And we really believe that screening for these things and addressing them is the best way to get people better. So we don't just want to monitor their physical condition, but also their state of mind.
Absolutely. And as a nurse, we spend a lot of time with our patients at the bedside. And in addition to our patients, we spend a lot of times with their family members, their loved ones, their closest friends, their caregivers. And we always want those closest to them to be keeping an eye out for depression and anxiety. Some tools that we can use for this screening is we have our GAD-7 and our hospital anxiety depression scale. We have our BDI screening for anxiety. We have our PHQ-2 and our PHQ-9 screening for depression. So, for patients with depression, we do have a class one recommendation to use psychotherapy and a pharmacology type treatment and intervention. But I do think it's important to know that in patients without depression, we have a recommendation against using fluoxetine, which is a new recommendation coming out of this guideline that we want our nurses and providers to be aware of.